Hi, we're going over the Modern Dental Assisting book today, chapter 33. We're going to be going over motion economy and the operating zones. So the first thing is motion economy. There are classifications of motions, and there are 5 categories according to the extent of movement. The first category is movement of fingers only. So what we want to do with these categories of movement is we want to use the least amount of movement possible and get the maximum amount of result out of it. So when we talked in chapter 25 about ergonomics, we talked about not straining and stressing the body. So with the motion economy, we want to preserve the amount of motion that you are using so that the body doesn't become fatigued at the end of the day. The body becomes fatigued because of too much reaching, twisting, and turning while working in the seated position. So when we're in the seated position, we want to use the least amount of motion possible. So we go through the classifications of movement. In the first classification of movement, you use your fingers only. That is like when you are moving just an instrument. You only need to move just your fingers. You don't need to move the rest of your body. You are manipulating an instrument with just your fingers. That is called class 1. Class 2 is when you need to move your fingers and wrist. So 2 things are moving, you're using class 2. In class 3, that is when you need to add the addition of your elbow. Maybe you are passing the instrument to the doctor. So you're moving 3 things, so it is a class 3, your fingers, your wrist, and your elbow. In class 4, you are adding the entire upper arm. So your shoulder, your elbow, your wrist, and your fingers. You're using 4 things to move, so it is class 4. So maybe you are reaching over to the assistant's table to grab an item, and then you are passing it to the doctor. So you're using your shoulder, you're using your elbow, you're using wrist, and you're using your fingers. And in class 5, you're using your entire upper torso. So in this case, you could be twisting. Maybe you're using the triturator to mix some amalgam, or the amalgamator, and you're triturating some amalgam. So you are going to be twisting to the side, opening the amalgamator, closing the amalgamator, taking the capsule out, pouring it into the amalgam well, filling it with the amalgam carrier, handing it to the doctor, and taking back the packer. All of those movements are going to be the use of class 5 because you're using your entire upper torso. So depending on how many parts of your body you're using is going to depend on what class of movement you're using. So remember that you're going to want to use the least amount of movement possible so that you can conserve, so that you are not fatigued by the end of the day. The next thing we're going to talk about is the operating zones. So when you are standing at the foot of the chair and you're looking at the patient seated in the chair, that we look at that as a basic clock concept, and that basic concept is required for the efficient and comfortable practice of team dentistry. That is when the doctor is working with an assistant. So the 4 zones are the operator zone, the transfer zone, the assistant zone, and the static zone. So it depends on if you have a right-handed or a left-handed operator where these zones are located. So it's very important to pay attention to this. We're going to start with the right-handed operator. So we have a right-handed operator and an assistant. If you are looking at this as if it is a clock concept, so you're looking at the chair, think about the chair, the patient being the center of the clock, and a circle going around the chair. So their head, where the patient's head is at, is the 12 o'clock. For a right-handed operator, between 12 and 2 o'clock is called the assistance zone. That is where the assistant will perform their duties. They should not be outside of the assistant zone, so you should stay between 12 and 2 o'clock. Between 2 and 4 o'clock is called the static zone. Nothing should happen between 2 and 4 o'clock in that zone, and nothing, no instruments should be passed there, there should be no tray there should be nothing happening between 2 and 4 o'clock. From 4 to 7 o'clock on the clock concept is the transfer zone. That is where the instruments are transferred back and forth between the operator and the assistant. Instruments, materials, curing light, whatever it is, anything that's transferred back and forth between the operator and the assistant happens between 4 and 7 o'clock on the clock, and that is the transfer zone. And from 7 to 12 o'clock, that is the operator zone. That is where the operator will be moving to get their best sight between 7 and 12 o'clock. So they will be positioned anywhere next to that patient between 7 and 12 o'clock. Now, that's the right-handed operator. The left-handed operator, we're going to think about the patient being the center of the clock, their head being 12 o'clock. For the left-handed operator, 12 to 5 o'clock is where the operator zone will be. They will be seated anywhere from the 12 to 5 o'clock position. From 5 to 8 o'clock is the transfer zone. That is where any material or instrument will be transferred for the procedure. From 8 to 10 o'clock is the static zone. Nothing should be happening in the static zone. There should be no transfer. There should be no one positioned in that area. And from 10 to 12 o'clock is the assistance zone, and that is where the assistant will be positioned and seated for their best line of sight. You can look up these zones on Google, and they also have them in your book for reference. Please know these zones and know where you should be and where you should be transferring instruments, where you should not be transferring anything, and where your operator should be.